During that time, I looked around and went, why do we have paper records? And didn't know that was, what a naive little question that was. Like, let's do something about that. So sometimes naivety is your friend because you don't know how hard it is and what you're about to get into. They're like, we need someone to help, but just tell the world that we do these things. And I went, I can do that. I'm that girl. Figured out that I really love to perform. I still love to perform, but now I just have a different song I sing, and it's about bringing information where it needs to go.
Wait a minute. So were you an actual, we have to clear this up. So were you an actual like musician rock star? Hey everyone, and welcome to another episode of the Health IT Playground. And I am stoked today because I have someone on here that has, guys, 25 years of experience in health IT. Okay. She is known for those that are on these LinkedIn streets as the Health IT Rockstar. So I'm sure if you're in this field, you've seen Health IT Rockstar, and this is the woman behind the title. And she's also, believe it or not, one of the 2024 AHIMA president-elects right now. So for those that are planning to vote, it's going to be in July. She's actually one of the candidates. So this is a really great way to learn more about her. We're going to focus on her journey, obviously, but just a cool way to learn more about someone that's going to be on that ballot, right? So excited to have here with me the one, the only Susan Lark. Thank you so much for joining.
Thanks for inviting.
Yeah, thank you, thank you. And I always start off this show with the same question to every single person. How did you learn about health IT?
Just in my experience, fall into it. So it's been just pieces over time before you didn't even realize it was health IT. So I'll think of you mentioned how long I've been in the business, and I was working at a front desk doing scheduling in notebook. And when we had our first computer systems, how to even make appointments online, how to do that practice management piece. And so not even realizing that I was part of that as that's getting implemented. So watching that evolution, so you're participating in it, but I wasn't working in it until, if you fast forward quite a bit. So I've, of course, used systems and always thinking of how do we make our systems better? Even, or could there be systems that aren't in existence yet? I think of like when I did provider credentialing and I had to mail all these verification forms. There's got to be a better way, and it's going to include this computer right here. What is that going to look like? So thankfully, it's probably evolved a lot. So my true, okay, it's really in my role, became health IT was in the aughts, which is that what we call them now, after the turn of the century in the 2000s. I was working at a very large student health center. So I live in Lafayette, Indiana, which is home of Purdue University, for anyone maybe heard of that. And it is a very large campus. And so we actually had a very large multi-specialty clinic.
Yeah.
And I landed here. Okay, it's important to note that it was a start over here in Indiana. I grew up in northern Northwest Illinois, and it so happened that the person I ended up marrying was someone I grew up with over there, or not grew up with, but knew in high school, and we re-met many years later, and he was already here. So I moved here and rebooted my career, because before that I was in managed care. I did a lot in clinics. And so I landed at the student health center and really started in the business office which I did a lot with just very entry level because we didn't do significant procedures, but I was doing coding at that point. Not it started working in the system there. Moved into as it was called medical records supervisor job was open. So I moved into that, something I've always been passionate about because I could actually spend another 10 minutes just on how I fell in love with that in the years past. And I actually looked at going to school for that originally in Illinois. The two major programs at that time for baccalaureate in Illinois, I was one class short of getting into their programs unless I sat out a whole year because they were very, I don't know if it was the same way when you went to school. They were very like, fall you do this and spring you do this. And if you can't jump in like a double Dutch jump rope, like you're not getting it. And anyway, it's funny that I was going to do that, ended up with a public health degree, and then ended up back in medical records, HIM anyway, because anyway, so I took the role of medical records supervisor. And by the time I left there 5 years later, it was a directorship. So I kept pushing for the value of what that department did. And during that time, I looked around and went, why do we have paper records? And didn't know that was, what a naive little question that was. Like, let's do something about that. So sometimes naivety is your friend because you don't know how hard it is and what you're about to get into. And thankfully, a whole bunch of people around me actually didn't know what we were getting into either. And followed me and said, that's a great idea, including our medical director, clinic director. And I had very fortunate that being at Purdue, there was a really great project management office that was our guidance. So the person who's actually my mentor still today works for AWS Global, like still the person I want to be. I want to keep going, like, how do I learn from her? But really taught me and some around me what it means to implement a large scale system. So that was really impactful. And then, so that was really my intro I'm really in health IT, implementing an EHR from beginning to end and then managing it as we go forward. And then from there, still at Purdue, they became a regional extension center when Meaningful Use came out. So back in the 2010s, which is now promoting interoperability, but I left the health center, but didn't leave Purdue for a different arm where we went out and we taught providers, hospitals, how to meet these objectives. And through that is how I learned the policy piece, because we'd have to read these rules and then interpret them and then go tell providers what they're supposed to do about it. Oh, there were tiers, sometimes mine, sometimes theirs. It was very valuable. But that's where then the policy came in, and that's really the core of everything I also care about now. I can pause there and see what other questions you have, or if you want me to keep going.
Yeah, so let's talk about policy, because policy is one of those areas on the AHIMA career map that looks so cool, but it's like, how do I actually start in this area? Like, what's your advice for someone that wants to get into policy? Because I don't know personally how to instruct someone to get into that specialty, but I know you probably do. So what's your advice for that person?
Super great question. And I love that you said it looks so cool. That I think it's cool. So let's get everyone else excited. And some of it will depend on what your setting is, because it really varies, because there's so many aspects that you influence the work we do. So let's just say it is a clinical environment. So if you more want to get into the policy side of that, you might be looking at how do you work with your compliance or risk management office. So and maybe an analyst job there, HIPAA privacy, and actually release of information departments, organizations, their life is policy. It's always changing on what the rules are, what the consent looks like. And that consent technology is a huge conversation right now And then even Direct Trust, I'll point at our logo that we're working on a release of information use case for how to use direct secure messaging to try to automate more things. Everyone's trying to. So that's where technology is, and operational knowledge is going to be an important part of policy. So how do you do that? So that's one entry point. Coding has so much policy. So if you don't think about it, again,
I'm like, coding?
well, I know that. Wait, what? Oh yeah. There are come out every year. So inpatient, outpatient, physician fee schedule, hospice, home health, all those rules get updated every year. And keeping on top of that is a big deal. If you're in the coding auditing, you're more in the compliance, you're more in the, I can't think of where I'm picturing someone I know who does this type of work. If you're really staying up on the rules that impact coding, that's still policy. Because I think like Sue Bowman at AHIMA, when I was on the advocacy council, I waited for her updates because it's its own animal. Like I am not a coder. I don't play one on TV. I just know to call them when I need it. I know you're out there. I know you can help me. So there's terminology also, I guess, sideways to, or the next pathway over. There's a lot to be done. And I was talking to a group about terminology and all the impacts coming out now, especially with like reproductive and what does that mean? What is more hypersensitive data sets? So how do you connect policy to that type of thing? There's terminology organizations. There's so many opportunities. Technology vendors need help. I think there's someone that on our work groups, one of our members who's privacy and compliance for a major HIE platform. And she's an RHIA, she's an AHIMA. So there's opportunities for us in that kind of world too. So getting your foot in the door with an organization and then figure out who's doing this work and who's looking at the rules. A lot of state government is a big deal. Trying to learn policy there. There's so many avenues.
Yeah, you can. I'm like, oh, okay. I didn't.
Somebody has to tell the coders, and you have an opportunity. This is where my passion point is on advocacy and policy is not only are you reading regulations to know what you need to do to be compliant,
Right.
you have an opportunity to inform them both during and before they're coming out. So there's always those payment rules every year have a proposed version, and you can comment on those. So this is an opportunity to really make change. You never have to accept things the way they are. Like,
Yeah.
if it's not making sense, if you don't like it, have that conversation with your regulators.
Okay. So what is your current job as of right now? There's so many things you do, I know, but like my audience, what are you currently doing for your 9 to 5?
We do have, and you know how in anybody's job, you have what you think is your job, and then it becomes something else. So I will tell you what that is. And then you sometimes just have a period of, and we have this special project right now. So we all live with that. And right now, for me, I have to give a plug that Direct Trust is holding a conference in St. Louis, September 22nd to 25th. So I have a lot of involvement there. I am hosting a main stage advocacy panel with some really incredible folks who do lobbying, who are attorneys. That's also super exciting. So that's part of my job, but I guess technically my role, the title is Senior Director Program Development, which that aspect is, there is a part of Direct Trust where we are an accreditation arm. So at our core, we're a standards organization and we're a nonprofit trade alliance like AHIMA, but our members are organizations rather than persons. So it's similar in that way. So that's like the main core business. That's how they were developed, but then acquired a whole accreditation body. And so we have up to 20 accreditations, all like privacy and security focused for different settings. So that's awesome. And then part of my job is I talk to people. like you, whoever does it, and find out what they're doing. And do any of our accreditations apply to them? Do they need a validation of their security program? Or do they do something where there's a place in the market that doesn't have an accreditation yet, that there should be one? So I just, my special sauce is connecting. And so I hear something and go, that connects over here. So one of our, as an example, our newest program we're about to develop. So I'm involved at the beginning, and then we started developing it. And then my boss took over and did this amazing partnership with Digital Therapeutics Alliance. So we're going to have an accreditation where we do privacy and security, and they're going to clinically validate application. So it's really, so it's almost, I think a lot of like your audience will be more familiar with the Joint Commission.
Yeah.
So it's just our accreditations are just a different thing that we accredit than a lot of times it's a technology vendor or.
Now
That's part of my job. And I'm advocacy and policy and create like thought leadership, doing all kinds of things.
yeah. And how did you end up at Direct Trust? I know it has to be a very fun story. Like, how did you end up working for Direct Trust?
I guess it all stems from that passion of, if you go on my Wayback Machine, that where I started at the front desk, and burden reduction and workflow are like my super passion to this day. And so even when I had roles in the previous years before I joined Direct Trust, where I was consulting more directly with health information exchanges or state government, I always had my passion was on, but how does this impact the end user? And Direct Trust has had such a focus on interoperability that whenever they have webinars or things, I was always online with them. I'm tracking this, I'm talking to them. And I was awarded the Interop Hero Award from Direct Trust a couple years ago. And I just stayed friends with them because I love what they're doing. And it just found out last summer, fall, that after they merged and brought in ENAC, the accreditation arm, that they're like, we need someone to help, like, just tell the world that we do these things. And I went, I can do that. I'm that girl. So, you want me just to go talk about all the cool stuff we do? I want to do that job.
So
That's what really happened.
yeah, so that
Getting
kind of
involved.
it shows the importance of supporting the things that you are passionate about, and yeah, just being consistent.
Attending, webinars. And I actually just had this conversation recently with a contact about things that we always say to the younger folks or coming up in the industry, of staying curious, always be curious, attend that webinar if you can. I know we always don't have all the time for everything.
Yeah.
And I'll interact with people in the chat and network online. And that's how I grow my awareness and my network, is to just put myself out there and get involved.
Okay. And right now, and I'm sure you've seen this, if you look on LinkedIn or any type of social platform where there's a lot of health IT students, the big complaint is, we got all these degrees, we paid all this money, we're getting all these certifications, and we're not able to find jobs, or they're not hiring me for whatever reason. I don't have enough experience. What's going on? What is someone that has 25 years experience? I have to ask you this question. What is your advice for people that may be watching or that will see this somewhere on what they should do?
I had a couple thoughts. One of them is just start. Don't be picky, because I think of one of the best roles I ever had, I had to be talked into, because it was like one of the first ones I had out of college. I was working for a physician hospital organization, and it was an executive assistant job that came open. And I thought, I don't necessarily want to do that. That sounds like I'm trying to move up. I want to be an administrator, blah, blah, blah. And my director, also one of my favorite mentors, said, no, I promise you, do this. It will help you. And it was the best decision ever, because I helped with accounting, contracts, all the departments. I was in every physician meeting. I was in every executive meeting. So I learned finance. Like I learned so much about how all of it fit together. So all to say, find organizations or parts of the industry you like, whether it's technology, it's the healthcare, it's state, local government need people desperately. And just get your foot in the door and start learning and just be extra. Like I think you also use the word extra to ask for more, ask a lot of questions, show your interest, and that will lead to another thing from there. So that's how I also think if any of your audience have any interest whatsoever in cybersecurity and security compliance,
Yeah.
huge shortfall of those folks. Even if those and don't just look for positions that require our credentials. As part of my platform, I'm trying to create that we have work to do on our value case. And what does that mean? Because having worked before this, the last several years in state government, health information exchange, they don't all know. They're like, those words look really good, but I don't know. So your resume looks nice, but what does this all mean? Experience is the key. Sometimes just get started and don't limit yourself. Don't limit your setting. I think there's healthcare everywhere. There's long-term care. There's healthcare in our correctional systems. There's healthcare, home-based care, home community organizations are now starting as we do the SDOH stuff. There's so much opportunity.
Okay. And where do you see health IT in the next 10 years? When I first joined, I felt like I had just seen a big change, and a lot has happened even in my short time being in it. So where do you see health IT in the next 10 years?
It's gonna get wild. I had two thoughts. One being, first of all, what is health IT now versus what it was? Because it used to be, it was like, this is health IT and this is everyone else who does something in healthcare. And you can't look at it that way now. Anything you do is tech. So they're not separate. So it's just all health IT is embedded in everything we do. But thinking of technology moving forward, there's so much that's going to need to happen on governance. So because of, got to say the words, AI, but the technology is developing, evolving so fast, faster than we can regulate it, faster than we can manage it. So getting some advancing governance around data privacy, data security, and segmentation of that data within, like the informatics piece. Having people who understand what's held within and how do we make it more granular and more patient controlled. So having more granular consents, that's a big thing that there's a demand, but not a solve for right now. Those are some things I think of, and we're global, even though our healthcare system is unique. Understanding the U.S. health system is ridiculous, but so somebody has to be really good at it. But then in other respects, all of our technology, I'm meeting with someone tomorrow. I was looking at his background tomorrow because it was just like, oh, he's an HIE developer, blah, blah, blah. Oh, he's an HIE developer, but he's working entirely with, oh yeah, there's healthcare in the Middle East. There's healthcare in Egypt. There's healthcare in, what does that mean to exchange or deal with information in a global regard? It's just an exciting world. Like it's big, very big.
Yes, and we need more people. So for those that are watching and you're on the fence, there's a lot of work. So we definitely need you.
And don't be afraid. And so that's the thing to, and maybe again, Gen Xer, but I know some of us have mental blocks, and sometimes I do of, that's not me, it's too technical, blah, 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 and don't be afraid of it. Jump in, learn the program, ask questions. Don't be afraid to be part of a technical solution, even if you're not a technical expert, because they need domain knowledge to have successful solutions.
Perfect. Now, I know right now you are a rock star, but I want you to look back 25 years ago when you were practicing your notes on your guitar, and I want you to just look back and think about and share with us what you would say to yourself 25 years ago when it comes to this career, this industry called health IT. Like, what would you tell yourself back then?
First of all, what I just said about don't be afraid.
Yeah.
You are capable and you are smart enough so that I would have limited myself because I didn't think at that point in my life, I didn't know. So not limiting myself in both what I can learn and who I can meet. So that every conversation, people will talk to you, expanding my network. I didn't really learn until I lived here. So I was well into my 30s, really understanding what network means. So don't be afraid to ask executives to shadow them. People, it's amazing. You are worthy. That's what I want to say. I think a lot of us suffer from imposter syndrome. But we have every right to be here. We're smart. We have contribution. Come on to it. Don't be afraid.
How do you network?
In this world, now we're all back on LinkedIn. They're doing multiple socials, but I think everything's on LinkedIn now. Also, if you can do in person, it's everything. So if you can go to regional meeting, you can go to even more so national meetings. I know that's a lot harder financially for people, but sometimes, especially for your audience, sometimes there are significant student discounts or free, or like our conference, we are asking as one sponsor opportunity is to sponsor students to attend. So we're looking out for them. And so where else can you do that? Things that are in person you just can't, it's not the same online. But and you can do this too. If you have someone you want to know more about what they do, ask them for a coffee, ask them for a virtual meetup. And it's amazing what people make time for if you're really interested in what they do.
Okay. And before I ask you how they find you, is there anything that you want to promote or mention? You mentioned that conference coming up. I want you to mention that again, but whatever you want to share to my audience, floor is open.
Yes, so much. Direct Trust Conference, St. Louis, Missouri, September 22nd to 25th. That's my number one thing I have to plug. Be sure to vote in your AHIMA election. I will be at the AHIMA annual conference in Salt Lake City too. I'd love to meet anyone in person who is able to make it there. But yeah, I'm on LinkedIn. Okay, Susan Clark is a pretty common name. If you type that, you're probably gonna get 50,000 people. But I promise you, if you type Health IT Rockstar, it will be, you can.
It's gonna be her.
Yeah, it's my brand. And it's all because once I figured out that I really love to perform, I still love to perform, but now I just have a different song I sing, and it's about bringing information where it needs to go.
Wait a minute. So were you an actual, we have to clear this up. So were you an actual like musician rock star, or did you just mean rock star in terms of just?
Oh no, all of it. My first
Really?
year, my first year in college, I had a scholarship for bass guitar. So I
Oh,
started out as a bass player, and all because I wanted to play the drums. I'm like, bass is next. So that's why I bought a drum set a few years ago because I'm a grown up now, and I also have drums. But then later on figured out I could sing. It's the same idea. I didn't try. I didn't know. I didn't think I was good enough, and found out I can also sing. So everyone needs to find their voice. But when I went to school for music and I just didn't love it academically, it wasn't there for me. I still love to play and perform, and anywhere we are, if you can find me karaoke, I am going to be there. But it just translated it was a beautiful morphing into what I do now.
I love that. Health IT Rockstar. So for those that did not know, because I did not know, we all learned where the name came from. So there is a story behind the name.
Yes.
I love that. Okay. Final advice for the person that is looking at you and wants to be you. They want to do what you're doing right now. What's your advice for them?
Keep networking, learning, introduce yourself, be unique. It's okay. Own who you are, own what you do, and just get out there and talk to people. I know it sounds so simple, but
That's
I have newsletters I look at every day and share. That's the part I didn't add. So not only are you learning, but share, give. So that's what makes me recognizable to people, because I'll be like, hey, I know this person needs it. This will be helpful for them. When they're, I didn't, nothing in it for me. I just know it makes the world better if we can share information or our gifts.
perfect. And how can my audience find you?
So we have LinkedIn, hashtag Health IT Rockstar. And then I am at the Direct Trust, so Clark@directtrust.org. And I have, if you want to just reach out to me personally, it's healthitrockstar@gmail. Real simple.
Love it. Thank you for joining me, Health IT Rockstar. This is awesome. Thank you so much for joining the show today. And for those that are watching, I know that you learned something from this episode. Please let me know what you learned. That one nugget, let me know in the comment section. I'll have her details as well. For those that want to find her, I'll put it there as well. And thank you guys for watching another Health IT Playground episode. And I will see you guys somewhere on social media, where I always am. All right. Thank you guys.